Welcome again. We want to talk about nipple discharges. And when we're talking about nipple discharges is the fluid that leaks from your nipple. Maybe at times it might be one breast or the two breasts. And it is most common in women or people assigned female at birth. And of course, people maybe in late pregnancy and immediately after childbirth. You understand? And when we're talking about nipple discharge, it happens for so many reasons. So let's go as we talk about some of the reasons that nipple discharges happen. Most of the times, there are they are just normal harmless reasons why people who are assigned female at birth might have nipple discharges, even when they are not pregnant or they are not lactating, they have not gone through miscarriages, and they are, things like that. However, nipple discharge may be a symptom of a serious medical condition. But what kind of nipple discharge is normal? You understand? So we want to know when to be able to reach out to your doctor or healthcare provider or something. Nipple discharge may be okay if it is clear, it is yellow, brown, green, or white. May be okay if it comes from both breasts. May be okay if it occurs only if you squeeze your nipples. It may be okay if it comes from several milk ducts. That is breast. Inside the breast, we have a whole lot of ducts. Nipple discharge, when we might say it is not okay, if it is bloody. If it is bloody. If it is blood discharge is almost always a concern. Nobody wants. We are all scared when it happens. And if it is not okay if it comes out of only one breast. It is not okay if it comes out on its own without you touching, sensitizing, or massaging or squeezing your nipple. And most of the time when it happens like that, it's usually accompanied by symptoms like breast pain, like redness, like swelling, or changes to your nipple. You understand? So when we're talking about nipple discharge color, the color is not very useful when it comes to diagnosing nipple discharges. You understand? White, clear, yellow, and brown nipple discharge could, of course, be normal. You understand? Most of the time, but it could also be abnormal. That is why you need to, take a quick action and get to your doctor. So bloody or pink nipple discharge is usually a sign of problem. Bloody or pink nipple discharge is usually a sign of problem. You understand? And the color of your nipple discharge typically depends on the cause. So it depends on the cause. And for example, we can say that yellow discharge usually indicates an infection. You understand? That you need to adequately go and treat with antibiotics. You talk to your doctor. While greenish brown or black may suggest mammary duct ectasia. You understand? There is problem with the mammary ducts. Then texture or consistency may also be a factor in finding a cause for nipple discharge. That is texture. You understand? There may be a cause. So depending on the cause, depending on the cause, nipple discharge can be thin, can be thick, can be tacky, like glue. We all know glue. How it looks like. Can be like that. But I want you to know also that nipple discharge is always abnormal in men or people assigned male at birth. It's abnormal. So don't think you see as a man you squeeze or something is coming out and you think it's normal. It is abnormal in male or people assigned male at birth. That is why it is important to have a healthcare provider examine your breast, and of course, to be able to determine the cause of any nipple discharge. You understand? So, in other words, what kind of nipple discharge is normal? So let's go. Nipple discharge, like I said, may be okay if it is clear, if it is yellow, brown, green, or white. But we want to know, where is it coming from? What happened? Why is it happening? We want to know. So what are the possible causes? What are some of the most common causes of nipple discharge? Nipple discharge is really something serious most of the time. It might not be something serious like breast cancer, but we have various causes. And there are several causes of harmless nipple discharge. We have a whole lot of that. And when we're talking about that, we have number one, hormonal imbalance. Because if you are a single person, you have not gotten pregnant, and you have excess prolactin, your breast, of course, will be bringing out water. Hormonal imbalances like during menstruation or menopause, pregnancy can be happening. Then, of course, pregnancy or breastfeeding or chest feeding can cause breast leak. Some medications, including these birth pain controls that we use, all these after pill or birth control pills, some of them they can cause breast leak. And of course, some depression drugs can, of course, cause that. Then at times we have something we call cyst. If there's some non-cancerous cyst can cause it. Then if there's nipple stimulation or friction, maybe from clothing or tight bra or something, it can occur. Sexual arousal can make it happen. Injury to your breast can make it happen. Stressful conditions can make it happen. Health conditions that may cause abnormal discharge, they are so numerous. But we'll be talking about some of them, so that if there is any abnormality that you notice, you'll be able to, go see your doctor. Number one is papilloma. It's just a non-cancerous breast tumor. It's not cancerous, it's a benign tumor, breast tumor. Then at times it might be breast infection or abscess. Or it might be mammary duct ectasia. It might be severe thyroid gland problem, that is hypothyroidism, you understand? And of course, at times it might be pituitary gland tumor. It might be also fibrocystic breast, that is normal lumpiness in the breast. Those are some of the things that can cause breast leaks. And of course, we have cancerous breast tumor, which is very rare in some cases, and of course, Paget disease of the breast. And it is also normal for newborn babies to have a little nipple discharge most of the time, which is usually caused by the hormones from their birth parent during pregnancy. Is the one that causes this to happen. But most of the time, it should go away on its own within a few weeks of their birth. And of course, people who breastfeed may also leak when there is excess production of milk and the baby is not sucking enough. It is possible, and at times after you throw away breastfeeding, you can still experience breast leaks. Overall, you should be able to see your doctor if you have any issue. Don't just wait and fold your arms and wait for what happened. See you in the next video.